Hi, in today's video we're going to be talking about one of the most common questions we get in regards to managing an injury that's been going on for quite a long time, such as an Achilles tendinopathy. We're joined today by our pain psychologist, Dr. Marlow, who's going to be talking about flare-ups. We're going to talk about what they are, what can cause them, and how we're going to manage them. We are treatmyachilles.com, which is an online physiotherapy service for all things related to Achilles problems. If you would like to have a look at any more information about our service or book an appointment, please have a look at the information below.
Thanks ever so much, Ali. I'm really pleased to be here talking about flare-ups today because they're a really key issue for many people. And it's often one of the most alarming things that my clients talk to me about. So it'd be really helpful now for us to kind of look at what flare-ups are, and obviously you want to know what we can do about them as well. So to start off with then, a flare-up is a sudden increase of pain which can stop you doing what you're doing and maybe lay you up for a couple of hours or even longer than that. It might also make you want to dive for the pain medications to kind of get you through the next while. Flare-ups unfortunately can happen to anyone with chronic pain. And chronic pain, just to be clear, is pain that lasts for more than 3 months. Nothing more sinister, it's just purely just a time factor. So flare-ups can come at any time, in any circumstance. And often they come out of nowhere at a time when maybe you are making some progress as well, which is particularly frustrating. Another thing I've noticed with flare-ups is that it often makes people think that they can't do the things that they want to, or also it gives them big worries that actually maybe they've made things worse. Understandably, flare-ups can be quite worrying or distressing. It kind of leads people to think things such as, oh no, I've torn my Achilles or put my back out again. It makes me think, oh no, I've made it worse. Clearly I can't do such and such. Maybe I can't do a squat or walk uphill, again, without injuring myself. Or sometimes people say things such as, what was the point of that rehab I've been doing for the last few months? It's all kind of gone to pot. Unfortunately, these worries actually contribute to the pain that we have and can also lead to flare-ups, as we'll find out later. So my aim for this video is to help people to think about flare-ups differently. So instead of thinking them as something which are out of your control, inevitable, and obviously a sign that something has gone bad, again, I'd like to help you to realise that flare-ups have many causes and often not what we think they are, but also that we can understand flare-ups in a way that will help us to reduce how long they last for and also to actually reduce them into the future as well. So why is this important? Well, as I've already said, not only are flare-ups distressing, but obviously it can also stop us from doing the things that help us. So, for example, I know that numerous people have stopped their physio because they thought that flare-ups meant that it wasn't actually helping them and working. But even greater concern than that, I'm aware that people will give up playing their sports or maybe even stop going to work or engaging in social activities because they're scared that they're going to flare up and make things worse for themselves. Obviously, this has huge implications for people's engagement in life and therefore their physical and mental well-being as well. So first up, what I really want you to know is two things. So the first thing is that if you've had chronic pain, i.e. pain for more than 3 months, it is very unlikely that a flare-up will mean that you have damaged yourself further or indeed that you're not even healing as expected. Now this is going to be the case regardless of any diagnosis that you have. The second thing I want you to know is that once you understand flare-ups, you can take control, you can reduce their severity, and also you can reduce how frequently they come until, in fact, you stop having them. So what actually causes flare-ups? Well, if you haven't seen my previous video, Persistent Achilles Pain, How Understanding Pain Can Help, please do so. Now, this video is going to be useful for whatever chronic pain you have, whether it be in your back, your knee, your shoulder, all the information will be relevant to you. But essentially, flare-ups are the brain and nervous system's way of protecting you. They don't want you to hurt yourself again, so they have gone on to high alert. So what does high alert mean? Well, basically, these are changes within the brain and the body, which means that it can make pain more readily. Pain, of course, having the purpose to make us stop or to do things differently. So this is helpful when we first have an injury. However, by the time we've had an injury into the 3-month period and we're in persistent pain, when this is no longer helpful. So we have many adaptations. The key ones relate to the changes in our nerves. So nerves obviously go into all of our body areas, and they're there to tell the brain of any changes which are going on. So what happens when we're in a chronic pain situation is that we have an increase in the number of those nerve receptors and also an increase in sensitivity of those nerve receptors. All in all, this means that a lot more messages are going up to the brain to be interpreted. Secondly, the brain itself changes. It wants to be on super high alert to make sure it picks up anything which can be a danger to you. And also it's geared up to make super fast decisions to set off the actions around your body which will protect you. This includes things like inflammation and moving differently. So let's look at these in a little bit more detail, because this really helps us understand what might be causing our flare-ups, but also give us clues of what we can do to better manage them. So if we look at the nerves, so what is all these extra nerves and all this extra sensitivity actually all about? Well, you will remember that we have nothing in our body that detects pain. We do not have nerve receptors all about finding pain in the body. Instead, our detectors can detect three things, and that is changes in temperature, hot and cold, changes in chemicals, changes in pressure, and changes in stretch. And when any of these happen too much, that's when messages can get sent along the nerve. So let's just have a look at a couple of these. So one, for example, might be chemicals. So it might be that if you have trained harder than normal and pushed yourself into the anaerobic training zone, that you have a build-up of lactic acid. Now, in the past, you probably would have been fine with this, but now because of that extra sensitivity, this is really setting off the alert signals. Or alternatively, maybe you're getting signals saying that you have stretched too much. But again, remember, this is probably because you are oversensitized and not, in fact, because you have stretched your muscle too far and therefore done it any damage. Next, the brain. So many things can trigger our system when our brain is on high alert. So any antagonizing beliefs, knowledge, thought, or memories all have the potential to bring on a flare-up. So I mentioned some at the beginning, but typically they're along the lines of, oh, I've hurt myself again. I won't be able to leave the house for a few more weeks, or now I'm going to have to miss that competition next week. Memories are particularly powerful at bringing on flare-ups and inducing pain. Here we have a level of anticipation, which in itself can bring on pain. So things like last time I did a squat, last time I ran to this intensity, it flared up, will be increasing the chances of flaring up once again. Third and finally, negative emotions and stress have the potential to induce a flare-up. So anything that brings on your fight or flight response, anything that brings about negative emotions has the potential to increase chemicals, which increase the sensitivity of the spinal cord. This in itself increases the likelihood of messages from your body making its way up to the brain for interpretation. So what we need to think of here, it isn't only stress and negative emotions associated with your pain or being injured. Instead, it's actually associated to anything in life. So whether or not you're having relationship difficulties, whether you're having a particularly tough day at work, whether you're worried about a competition which is coming up, all kinds of things all have the potential to bring on a flare-up. So now, of course, the all-important question, what can we do about them? So from my perspective, exactly what you need to do is very personal to your own triggers and situation. However, generally, there are 4 time phrases that we can think of and therefore things that we can do within them. First up, what do you do immediately? Well, remember that stress can bring about flare-up and pain. So the first thing to do is to remain calm. Try not to worry. Do whatever you can do to make yourself feel safe. So this could be resting up for a little while. It could be using a hot water bottle. It could be listening to good music. Whatever makes you feel relaxed, happier, and safer. Think positively. So instead of thinking, oh my goodness, this is it, disaster, calamity, instead think, it's okay, it's just a flare-up, it will soon calm down, I'll take control, and I'll get going again soon. So the first phase is all about being calm, safe, and positive. The second thing to do is to reflect, learn, and change. So obviously we've mentioned lots of things today which can bring on a flare-up. So let's think back and think which of those may actually apply in this situation. So Are you going through a particularly busy stage in your life right now? Even if you're not finding it stressful, it might be that it is setting your flight syndromes off a little bit. The next phase is obviously getting going again, which you should be able to do within a reasonably short period of time. But what's really crucial to do is to avoid the boom and bust situation, which I'm sure your physio has warned you about. If you think about it, you have a sensitized system. The more you go into boom and bust, the more you're teaching your brain that it needs to be scared, it needs to protect you, it will bring on more pain. So it's really important that you start off at a level at which you know you feel safe and to move up really, really slowly. And then the final phase is into the future. So it takes a little while for your brain to want to stop protecting you and for your body to desensitize. So unfortunately, it is possible that you will have flare-ups for a little bit longer. However, repeat the above every time you have a flare-up. Don't panic, see what you can learn to change it and avoid that boom and bust. Over time, what will happen is that you'll become less sensitized and the flare-ups will become less intense, last for less long, and will occur much less frequently. Finally, just to say, it is really rare for a flare-up to last more than 2 weeks, particularly if you've done all the things that we've talked about today. However, if you still find yourself in pain which is stopping you from doing things after 2 weeks, please see your physical health professional or your GP.
Thank you, Caroline. That was perfect. That's helped us answer lots of questions about flare-ups, and it's covered lots of topics that I commonly get asked by my patients about what may cause a flare-up and how best they can manage it. So if people would like to find out a little bit more about you and how they can contact you to help with pain and injury, how would they go about doing that?
Yes, thanks ever so much, Ali. So if you have injury and pain and you think that I can help you, please do get in touch. The information for my website and contact links are obviously placed below. If you go to my website, on the top right-hand corner, there's a book support button. Press on that and it will take you to links for all my support options, including a 15-minute chat for free where we can just discuss how I might help you.